If you're building hospital software today, patient engagement is no longer a feature request, it's a revenue risk. CMS penalties have changed the rules. Hospitals now expect their core platforms to extend beyond the EHR. In this deck, I'll show you how your software can close that gap, protect hospital revenue, and unlock a new growth stream for your business. You already see this shift in your customer conversations. Hospitals deliver high-quality clinical care, yet CMS penalizes what happens after discharge. That post-discharge window has become a board-level issue. CIOs and CFOs are now asking a simple question: which vendor helps us control that risk? This is not a corner case. CMS penalizes the majority of U.S. hospitals every single year. These penalties are automatic, non-negotiable, and applied across all Medicare discharges. From a platform perspective, this creates a permanent risk surface, and hospitals expect their vendors to help manage it. When you zoom out nationally, the numbers are staggering: hundreds of millions in penalties every year. And this is only the penalty line item. Hospitals see this as systematic financial leakage. They are actively looking for technology partners that can help reverse it. Now add the real cost of care. Each readmission costs thousands of dollars. For a mid-size hospital, this compounds into tens of millions annually. This is not a clinical failure, it's a failure of execution at scale. And execution is exactly where software should win. The data is consistent across studies. Most readmissions come down to missed medications, missed labs, missed follow-ups. Humans cannot scale daily engagement across tens of thousands of patients. This is a systems problem, and systems problems are solved with software. Traditional hospital systems were designed to document care, not to execute it at home. Portals are passive. Alerts are ignored. Hospitals now expect their core platforms to actively drive behavior, not just record it. That expectation is landing squarely on vendors like you. This is where Briea fits architecturally. Briea doesn't replace your platform, it extends it. We take structured clinical data and operationalize it into real-world patient engagement. Think of this as an execution layer that lives outside the hospital walls. Proactive engagement changes outcomes, and that's proven. When systems initiate instead of waiting, adherence jumps significantly. Briea operationalizes that logic across medications, diagnostics, lifestyle, and follow-ups continuously, not episodically. Channels matter. Portals don't scale. Apps don't reach everyone. Voice and WhatsApp do. This is how you reach elderly patients, multilingual populations, and people who never log into portals. From a CTO lens, this is about maximizing reach with minimal friction. Discharge summaries are static documents. Real life isn't. Briea turns those summaries into living care plans that adapt week by week. This is how instructions turn into action, and action turns into outcomes. When this is deployed correctly, outcomes are predictable. Most health systems see double-digit reductions in 30-day readmissions, and in high-risk cohorts, the impact is even higher. This is measurable value that hospitals can defend to their boards. Here's the key point for vendors. Hospitals are already paying for this. Engagement and readmission reduction are funded, recurring budget lines. This is not experimental spend, it's risk mitigation spend driven by CMS. For your business, this creates clean upside. New recurring revenue, stronger RFP positioning, and lower churn. You're no longer selling features, you're selling financial protection and measurable outcomes. From an engineering standpoint, this is low friction. First, workflow independent, white label ready. You monetize the outcome layer without rebuilding your core platform or expanding support teams. Hospitals don't want another vendor. They want their primary vendor to solve this. White labeling Briea lets your platform own the engagement narrative and the engagement budget instead of losing it to standalone apps. Hospitals are already paying to reduce this risk. The only real question is whether your platform captures that value or leaves it on the table. Briea lets you turn post-discharge risk into platform-level differentiation.